This was a recent MCQ regarding treatment of scabies. So watch this video till the end to know what is the treatment in infants and also in pregnant women. Hello dear students, myself Dr. Maddineni Srinivas. So in the infants, the treatment which can be safely used is permethrin 5%, sulfur 5 to 10%, crotametone 10%, benzyl benzoate 6.25%. In pregnant women, we can use the same permethrin and sulfur, and spinosad 0.9% can also be used. So these are all the topical preparations which are available: ivermectin, permethrin, sulfur, benzyl benzoate, lindane, spinosad, crotametone 10%. But out of all this, you can take a screenshot of this. In the infants, remember, permethrin 5%, sulfur 5 to 10%, crotametone and benzyl benzoate 6.25%. All these are safe to be used in the infants. Spinosad 0.9% is only safe after 4 years of age. Coming to the pregnant woman, we can use permethrin and sulfur and spinosad 0.9%. So this is very important. In the NEET also maybe this can be asked, because in the INICET it was asked. Like this video and subscribe.